trying to manage and care for patients in this sort of environment is really, really difficult. It's just gone on for such a long time, and I think people are stressed and tired. The vaccine is an opportunity to give ourselves, our friends, families, and our patients more protection.
Anything new, people are scared. And I think that's what the problem is. I think educating people about the vaccine will prepare people.
It's not called a pandemic for no reason. It's killed thousands and thousands of people, and it's generated fear. It's affected people's lives, businesses. It's really important to continue to raise awareness.
Since this COVID started, I was affected for myself. I was ill with COVID. I remember the ambulance picked me up and I said bye to my kids, and I thought, I'm not going to come back. You know, I wrote a letter with everything what was important they needed to know. And inside it was like, because I couldn't breathe as well. I couldn't express, and I was trying to say my byes, and the way I saw my girls look at me, it's very emotional because I thought I wasn't really going to come back. I thank God every day I'm here and I'm able to even express what I'm saying now. Many people haven't had the chance, and they haven't been so lucky.
I certainly will have the vaccine. I think although I've had the COVID infection at the start of the pandemic and still have antibodies, there's no guarantee that it's going to provide me with the immunity while the pandemic lasts. I do not want to catch it again. I do feel exhausted. I'm not able to actually do as much as I used to do. And I get aches and pains, which makes me feel like I've aged around 20 years before my time. Not how I want to feel at this time in my life.
I have underlying health problem like diabetes and high blood pressure, and I want to protect myself and my family, my colleague, and my patient.
In my day-to-day work, I'm working with patients who both have been exposed to COVID or currently have COVID or even have long COVID, post-COVID symptoms. It can have long-term effects on your cognition, on your memory, on your physical well-being, your lung capacity, all those types of things, which isn't only going to affect you in the short term, it could actually, and we don't know how long it might affect you in the future. Being able to have access to the vaccine and have that kind of source of protection will not only protect you, but it will protect your loved ones and help kind of get us back to a normal way of living and take the pressure off of the NHS so that we can now treat patients with these long COVID symptoms.
We've had members of staff who have been shielding for so long, and I know they're desperate to come back to work, but they're also really, really scared as well. I fall within the Black and minority ethnic group, and I know that COVID-19 has had a significant impact on members of my community. I just wanted to do whatever I can around raising awareness.
I will definitely take the vaccine because I think it protects all of us as staff working in NHS, as well as the patients that we look after. There are myths about injecting the virus in our body, developing our natural immune response. But this vaccine is not a live virus vaccine, and therefore the side effects that can be expected of a live virus vaccine is not the same as this one.
I was previously one of those people. I had heard quite a lot of things on Facebook and social media that I thought, oh, actually, I don't like the sound of that. But I had done my own research and disputed quite a lot of these myths. And that tends to be something that I then say to people. I ask them where they got these informations from. So people are worried that it's being rushed or that they're worried about the side effects. If you actually go and do the research about it, the side effects are so limited. Firstly, you can get side effects from anything. You can get side effects from paracetamol. So my advice is giving to staff who are a bit worried about getting the vaccine is just to do your research and not to internalise other people's views or stuff you read that's not on validated websites like the NHS website and the government website.
What I do say is that we would still have polio if we didn't take vaccines, and that's why I really believe that obviously being of a certain age, shall we say, when we had to take polio and tetanus, etc., then it's really important that we that we take the same approach and have the same responsibilities for our younger generation.
Basically, what I would be asking staff is to listen to the comms and listen to the information that is communicated through the trust, not go onto social media and get your information from there, because there is all sorts of fake news, different views that actually isn't helpful. So what I would want staff to do is base their decisions on the facts.